of your medical history in one place. It's a time saver for both the patient and doctor. In tonight's Healthy You, we look at the benefits of MyChart.
When Lauren Dean first got to Wichita Falls from Houston, finding a new OBGYN was a must.
I'm new to Wichita Falls, so it was really important to me that I could find an OB, since I'm pregnant, that would be able to communicate with me quickly, that I could ask questions to.
Dean quickly learned about United Regional's health information system, MyChart.
So it allows them to access the system, look at test results, schedule appointments, request medication refills, or send messages to their provider. So really giving them some autonomy in their overall health communications. We recognize that there's a large number of our patients that like to talk to people on the phone, right? They want that personal connection, and that's great. We want to make sure that we're always offering that for our patients. But we're seeing a shift where a large percentage of our patient population want self-service. They want to be able to do it at the convenience that works for them, at the time that works for them, and in the way that works for them.
Your health care in the palm of your hand. Gone are the days of your doctor's office handing you an appointment reminder card.
For me, with my pregnancy, I see the doctor a lot more than I used to. So if I ever have, a moment where I've forgotten what time my appointment is or what day, I can just quickly log into my app and just look there and not have to worry about calling, not have to worry about, communicating during business operation hours. With all the features that MyChart offers, you just have nothing to lose.
Whether it's 4 in the morning or 10 at night, patients have access. Not only that, but they can message their provider right then and there.
Being able to send your provider a message to say, this is going on, what should I do? Could you call me? Do I even need to schedule an appointment? And knowing that you'll get a response within typically 1 to 3 days, you are able to really manage that overall communication with your provider in a way that works well for you.
There's a place for everything, and everything is in its place. The platform makes it easy to find test results, schedule appointments, view doctor's notes, and message your provider. It's locked down information unless you choose to share it.
It is a secure platform, and the nice thing is you have the ability to allow others access to that information. I like to use my husband as an example often, and so unfortunately my husband has some healthcare needs, and so through that process sometimes understanding communications or test results and what those mean can be confusing, and so we like to be able to look at all of that information together.
With one of the greatest features being Fast Pass, which means if your appointment is a month out but another time becomes available sooner, you get first dibs.
It decreases that wait time for you to be able to see your new family practice provider, for example. And on average, it saves about 22 days overall from the point that you are trying to schedule that appointment to getting that first patient appointment.
Saving time and headache.
There's a lot going on in life for everyone, so if you can have something that's really streamlined that makes your health a priority, I just highly recommend MyChart for anyone, no matter what stage of life they're at.
Your health information in one central location.
MyChart requires 2-factor authentication, doubling down on security. You can visit MyChart and create an account through its app, online, or by visiting your physician, who can provide you with a secure code. There is a number you can call for assistance. Find that on Texomashomepage.com.